Hello friends, and welcome again on our AIS platform to share something again new, which hope all of you can listen, then think, and then see how it can benefit all of us as well as people associated around us. So today I'm going to talk about the suppressed emotion or various other kind of day-to-day emotions which we all go through without recognizing, without understanding that how these emotions can impact one's well-being, not at a physical level or mental level, but overall how it totally deplete our inner system, which we nowadays call as our immune system, or from Ayurvedic perspective it has been shared with us from centuries that your ojas start depleting. So it's not that in our Western medicine we don't recognize that. I'm sure all who are associated with the medical system, they understand about the psychosomatic disorders. And whether our psychologist or neurologist, everyone talk about impact of the psychosomatic disorders. But the difference is that in our Western concept, that part is talked about but never looked into. Whereas in Ayurveda from centuries, this has been clearly defined and also have been given very clear skill to an Ayurvedic practitioner that how they can identify in their client in the consultation that what kind of problems this client can have in the coming year based on the identification and the diagnosis what they have done through their suppressed emotions or the different kind of emotions they go through that. And these all can be diagnosed with the different skills what Ayurvedic practitioner have, whether we talk about the pulse diagnosis, whether we talk about Ayurvedic iridology or various other diagnostic skill what Ayurvedic practitioner learn. But then, as I said, in our Western medicine, these things get talked about and never looked into. But an Ayurvedic practitioner will identify and then given a structured program for the client. It is in a different aspect that whether that client want to follow them, understand them, and help themselves to prevent those problems, such as whether it is in a simple memory loss, which is the very primary impact can happen, or later on become more aware with the dementia, Alzheimer's issue, or even stuttering can happen, tremors can happen. And not only these, then you might have a more impact on your physical well-being, your blood pressure, your liver disorders, your gut disorders, and then on a serious level, various cancers which we see nowadays are becoming more and more and more prevalent. Right? And we always try to look into their cause among various researches what we do in our labs, and trying to find out what genetics impact are leading toward that kind of cancer or that kind of problem, or what the other aspect are playing a role. But no one tried to look into on a serious level that how this client who is going through a lot of these suppressed emotions, unresolved emotions, or on a daily basis, that anger, frustration, jealous, hatred, speaking lies, cheating, how these things are impacting that individual. Because all these emotions will burn that individual first, rather impacting the other person about whom that individual is thinking about. And this is one of the biggest difficulty what world is facing at the moment. We all want to live in delusions. We all want to live or are living in a denial. We don't want to face the realities. We want to mask our all the symptoms, whatever going in our life, by taking one pill or the other, or if these are impacting my day-to-day life, sleep issues or other, then go through the sleeping pills, and then different kind of drugs you take, mind-altering drugs, or on a simple your marijuana or other kind of thing, so that you can run away from those thoughts. But they will never run away. They will never go away. They are always going to be with us until or unless we look for their solution. And this is where the role of Ayurveda comes up. Ayurveda talk about very clearly in Ayurvedic psychology. That is what Ayurvedic psychology is totally different. Ayurvedic counseling approach is totally different. Rather than just giving you an opportunity to speak about your problems and then giving you that assurance that yes, you are going through a very tough time and you are having a difficult aspect, and then rather giving the solution to the person, they will be guided or advised that either you get out of this solution problem, right, or try to look for a different path. You don't need to suffer from these problems. You are not supposed to suffer from these problems. You are not born to suffer these problems. But no one gives you the solution. And this is where, whether you talk about an Ayurvedic doctor, Ayurvedic practitioner, at whatever level you are, and for how many years you are practicing, or you are a yoga practitioner, no matter since how long you are doing whatever type of the yoga you do, and you still suffer from all these various ailments. Sometimes you have an atrial fibrillation happening all the time, high blood pressure happening all the time, you are losing your voice all the time, having murmurs all the time, different kind of ailments comes our ways as easy, as quickly as it can happen to anyone else. And that's where one need to sit and ask themselves that why these problems coming to me so frequently and so easily. I always have shared problems can come to any one of us. And this has been again very clearly defined in Ayurveda and Ayurvedic philosophy. Even with the yogic philosophy, this has been very clearly defined that your sufferings can be at a various level. And those sufferings, what we call as Deva Vyapya, Chikitsa component, because your previous karmas are also going to play a role in your those ailments. So it's not that we need to worry about, but what we need to understand and worry that when we talk about these suppressed emotions and these kind of emotions what we are going through on a day-to-day basis, our, as I mentioned, cheating, anger, frustration, jealous, hatred, speaking lies, cheating someone, they all will impact, and that's what need to be identified. Your good diet, yes, will give you one level of protection, but then that good diet, what is that based on? If you feel good diet is that how much protein, how much carb you are having and no fat is coming up, because that is what you will go and get a wonderful dietitian and nutrition advice where the fat component will be out, or even if you are visiting a cardiologist, that also will be giving you that understanding that don't even think of what we call as in Ayurveda ghee, clarified butter, pure poison for many of us, right? Or not even having any other kind of fat. And then many of us who, based on our ethical principle, go into vegan diet and then try to pick up those kind of substances which can be more counterproductive, what we call as our all plant-based milk, or this is just one example. So what I'm trying to share is that many of us will try to make our own rules for our well-being, whether it is sometimes the ethical principles we try to bring into, right? And when we say ethical principle, those all who will be suffering from various deficiencies will be using those kind of products which have crossed all the ethical principles of making those products which comes in your hand in the bottles, because all these lab tests which are done on those animals, right, and the cruelty which is done while doing all those researches, so-called researches, by inducing the disease in that animals, whether it is rat, whether it is cat, whether it is pig, right? And then making them suffer, and then adding those drugs, and then bringing up different kind of so-called supplements in your hand, and you have to use them because you are going through a lot of deficiencies based on your ethical principles of living and not eating certain different natural products which are available to us. So these are the different gradations of our problem. But coming back to these mental and emotional issues, that how these can really be the core cause of your all the problems, especially at a mental level, emotional levels, and then the physical impact happening. Don't think that they are coming from anywhere else. If you have these sufferings, if you are going through a lot of suppressed emotions, because what they do, if you look at from the physiological level, it can be very clearly explained. If you look at the structure of the nerves, how the nerves structure can get affected. Nerve structure is very much well explained to anyone, even in a school level, these things are very detailed studies are being done, that the structure of the nerves and then all the neurons and axons, how they get affected. And if you are able to look at very closely MRIs done, and if you see the brain MRIs when it comes to the spinal part, where because when you see the MRIs, what the radiologists do, they just try to look at the reports. I'm not questioning because I'm not to their level, but I always do these studies myself. And when you able to magnify these your MRI reports, you are able to see the impact happening to those nerves. And then those impact on those nerves are based on if someone is having a lot of anger, lot of frustration and jealous and hatred, the impact on those nerves will be totally different. You can easily pick up. And then those who are suffering from the emotions of fear and panic and worries and then cheating and lies, the impact on the nerves are totally different. And that's how you can pick up this maybe even 10 years ago. And then you can give the aspect to that client that, look, this is what's happening. You can show them those MRI reports and share with them. So that is the way Ayurvedic practitioner can help you to protect you and prevent those problems coming your way. But this has to be done in a much more thorough learning and understanding, which is not that something you are going to do or everyone do, but if our problems are there, what you need to be more interested that these problems can be taken care of. And for them, not all the time you will be relying on whether you go with the ashwagandha or brahmi or jatamansi or those kind of herbs, which definitely has the ability to correct the core cause as long as they are used in a correct way, correct dosages, correct combination. Right? As I always have mentioned, Ayurvedic herbs will have no use if you are using them as a single herb. Ayurvedic herbs work with the synchronization, synergy of the herbs. That is where the first part is, and then the correct dosages has to be used. But then on top of that, if you are using those products and not improving your lifestyle, not improving your diet, not improving these all factors which are the core cause, and not following an Ayurvedic counseling and Ayurvedic psychological program, then outcomes are not going to be what you should be looking for. And that's what happens all the time. And again, you don't need to go anywhere. You need to sit back with yourself and ask yourself, I'm practicing yoga for the last 40 years. Why I'm having these sufferings? Why and then many of you might be doing meditation for the last 40 years, 30 years, 20 years, 10 years even, and then I'm still having jealous and hatred and anger. Why that is the case? Reason is very obvious. When you are not having a complete approach, you will be suffering, and that's what you should look at. And this is where I always talk about that. Look, in our medical system, when we talk about medical system have different components. One is medical doctors. You cannot question medical doctors. Medical doctors have their own skills, own strength. If a surgeon is there, his or her role is to do the surgery to the best of his intent. Then come the next part. is the drugs which will be given to that client after the surgery, after the operation. And those drugs has to be those which are being provided to that surgeon by the medical department. And that's where the role of the drug companies comes in. And now the drug companies have their own aspect. They have two agendas, we all know them. One is that they have to keep inventing new drugs because the previous ones are not having a good effect on the problems for what those drugs has been already in the market, as well as the problem is the resistance of the individuals towards those drugs, and those ailments are getting more and more, and hence those drugs are not effective. But why that is happening, no one looked into that. And that is where again the approach of Ayurveda comes up, that why the problems of these drugs resistance and all is happening is because of the lifestyle, because of the diet of that individual. Now in the same way is recovery. When I'm talking about after the surgery, the role of the surgeon is finished now. He or she has done her good work. And now when the recovery is coming up, recovery is based on that individual, her immune system. And that immune system is based on what they have been feeding themselves, physically, mentally and emotionally. So where the role and where the fault of the other people's are or the doctor's fault is there. So we don't need to always blame the medical doctors that they are not doing their job properly. Medical doctor has their own job, but then the drug companies and all the drugs are coming up, they have the biggest factor. But then on top of that, individuals' lifestyle, individuals' diet, mental and emotional factors also play a role. So when we are looking for something within one objective to help our mankind, help our people, then we need to get out of these different boundaries. Time is coming that we all, whether it is the medical doctor, whether it is the Ayurvedic doctors or practitioners, they all have to come together. And why I say about Ayurvedic doctors and Ayurvedic practitioners specifically, because Ayurveda gives all of us a totally different concept and aspect for the healing of the mankind as compared to the Western medicine concept. You can't just go around and try to pretend yourself as a complementary medicine practitioner if your approach is still based on the Western pathologies and Western physiology. That is not going to make you an alternative practitioner. Alternative practitioner, even if you want to say to this system, you must have a totally different approach in the physiology is understanding, pathology is understanding, pharmacology is understanding, and then the psychology understanding, which this Ayurvedic science provide us. And that is the where time is coming up, that we have to keep our egos out somewhere in the box and then work on in a much more cohesive way together with a one objective only, how we can help our mankind, how we can help our people who are suffering from various problems. And as I shared today, this is one of the major aspects, that while we always try to look at one way or the other to make some changes in our diet or other factors, but then if we don't look at the day-to-day emotions, suppressed emotions, unresolved emotions, which is happening to every individual at a different level, that how they're going to become the core cause of my all the problems, whether it is my memory loss, whether it is the dementia or Alzheimer's or other problem which I can suffer. And again, as I said, Ayurvedic practitioner can give you a very clear marker that in 5 year time, 10 years time, you might be suffering from this. So let's work together. Let's mitigate these problems. Let your ego get away. Let your all these jealous, hatred, anger, and other suppressed emotion. Don't let your foundation get affected. Because this is what Ayurveda shared with us, that we have different levels of our foundation. Not just this physical body, what we can see and what we trying to build our muscles and others in while fighting with the machines and the gyms and other. Your 6 apps are only going to be with you till the day we go to the graveyard, right? And they will get burned there. And they will be of no use if you having a memory loss and if you're suffering from your dementia. Then 20, 30 years you have to live with that pain that you don't know about yourself, you don't know about people around you. Do we need that life? And if yes, we don't need that, if you are honest to this answer, then there is only one solution that work today. Try to look into that how these suppressed emotions, how our day-to-day emotions, which are burning us from inside, burning our nerves and impacting our nervous system, and then impacting our different organs. And then if you are looking for a solution, you must take action now and follow the advice of a traditional Ayurvedic practitioner who can advise you specifically. I always put more and more emphasis on that you must visit to the traditional Ayurvedic practitioner, because as yoga you already know, as meditation you already know, same is with the Ayurveda. These all modalities have so much to offer to the mankind that they are coming back more strongly in our current life, because people have only one hope with these modalities, these philosophies to help them. But then there are so many opportunistics who are sitting and on the name of Ayurveda try to put these into different bundles, whether they put it into the different leaves and try to give you that this is the medicine for your endometriosis, this is the medicine for your ulcerative colitis, and this is the medicine for your dementia. That is not what Ayurveda is. Ayurveda is, and again, in a bigger picture. Same is with the yoga. Yoga is not a rock yoga or naked yoga, or yoga has a different concept. Until or unless you follow the yama and niyamas, you are nowhere. That is why I always say that you are following yoga for 40 years and still eating all those kind of food which we call as from yogic philosophy, tamasic, rajasic, and how those definitions can be done by you in your own house, in the backyard, while sitting and enjoying the marijuana and the organic wine or beer. No, you can't define your own definitions on well-being. You must accept, keep your egos away, keep those emotions away, and live in a much more healthy life. This should be your resolution today, which is the last day for 2024. A new year is coming up. Start a new life. Start with a new objective, new focus, new commitment that I want to live in an honest life. I want to live in a pure life. I want to help people with my all passion, commitment, honesty, and that honesty, dedication will only come when you look into yourself in the mirror. Make one day, today at 12 a.m., when the new year will come, stand 5 minutes in front of your eyes, in front of the mirror, looking into your eyes. And if you can speak to yourself for 5 minutes without taking your eyes away from your face, that am I free from all these jealous, hatred, anger, cheating, lies? If answer is yes, you will keep facing yourself. If the answer deep down is there, two changes you can see. One is you can run away from your eyes. You will never be able to face your eyes. Second is you can use the technology. Nowadays all of you have those different kind of watches where you can see the heart rate. When you speak 5 minutes, watch your heart rate. If your heart rate is now going to the 90s, 85, it means you are speaking lies. So everything is nowadays very crystal clear. So try this. This will be your gift to yourself as a New Year gift. Thanks everyone.